In this clinical teaching guide, we will focus on integrating the student into practice. You've prepared the student for the clinical experience, and now they've arrived. What's next? Here are 5 steps for integrating your learner into a busy practice. Orient the learner to your practice. Encourage your patients to accept the learner's role. Adapt your schedule when working with a learner. Keep the flow going. And finally, find time to teach. Orientation is essential. Without it, it can take days or even weeks for a learner to figure out the basics of your practice. Orientation is an excellent way to ensure that you and your student are on the same page. It doesn't have to be an official sit-down meeting on day 1. Consider forming a checklist to cover the most important information about your practice. Orientation covers the basics of your student's time with your practice, such as what to bring, dress code, typical hours or schedule, parking, and more. Orientation also allows you to showcase your expectations for the student. This can include your teaching style, your pet peeves, how often you give feedback, and other factors. The majority of patients both enjoy and benefit from the presence of learners. Consider taking steps to ensure all patients are aware of and prepared for student learners, such as hanging a notice in the waiting room, confirming that patients are willing to be seen by a student, and allowing patients to evaluate students. Depending on the level of involvement the student has at the clinic, their presence can lengthen the clinic day by up to 1 hour. Consider scheduling an additional 15 minutes for patients who will be interacting with the student. Every week or 2, prepare to observe the student performing a history and physical exam. Remember to keep things moving. The student does not have to see every patient. Develop a pattern for how you and the student see patients. The student can always be called in to see a demonstration, even if they didn't work with that patient alone. Try to pick one concept to teach and stick with it so as to not get too bogged down. It's helpful to be specific about what you would like the student to do in each encounter and how much time they have to do it. The student will learn from just watching you interact with patients. However, ensure that formal teaching time is included. While seeing patients, consider the following: using time-efficient teaching strategies, such as the 1-minute preceptor, highlighting 1 to 2 things to focus on during a patient encounter, and making notes to discuss additional concepts later on. Here are some options for finding time to review with your student. Set aside 5 to 7 minutes at the end of the day to review the patient scene and to allot for any questions the student might have. Consider using the lunchtime as a working lunch with the student while minding privacy concerns. You can also make time for student-directed learning by setting aside a time for a student to teach you about a topic, collecting readings to share with the student, and self-reflecting on which of your teaching strategies are the most effective. This video is produced by the Office of Faculty Affairs and Development at the Burnett School of Medicine. Thank you for watching.